Assalamu alaikum. I'm Dr. Abdurrahman Muhammad Alam. Welcome to today's Cataract Surgery Insights into a case of IFIS, that is floppy iris syndrome. My 15 Cataract Surgery Insight points to deal with IFIS are given in this video. You can pause the video and note them down, and I will demonstrate them in this surgical video. Now I'll make a sideport incision with a 1.1 mm NVR knife, which will give me a long and narrow tunnel. Following which I'll give diluted adrenaline to cause further mydriasis. Then I'll stain the anterior capsule with Tryphan Blue. Wash out the Tryphan Blue with BSS with low and steady flow of BSS. This will prevent billowing of the iris and iris prolapse. Now give intracameral dispersive OVD first and then second cohesive OVD to form soft cell technique. Now create a biplanar main port incision with a long tunnel length. Underfill the AC to prevent iris prolapse. Now create a continuous curvilinear capsule rhexis with the help of a bent cystitome. Now express out some OVD prior to hydrodissection. Hydrodissection with slow and smooth fluid flow to prevent iris prolapse and billowing. Now replenish the OVDs that are used for soft cell technique. With the help of Sinski, rotate the nucleus. Now with a low flow, low pressure phaco will be employed with a low bottle height, low vacuum. Pre-phaco is done and remove the epinucleus and loose cortex. Direct vertical chop is performed and multiple chop will be performed on this two heminucleus to form multiple small nuclear pieces. Now emulsify the chopped pieces by single hand technique and avoid the use of a second instrument, and try to emulsify the pieces anteriorly. This will prevent iris billowing from the current created from the continuous irrigation from the phaco handpiece. Corneal endothelium is protected by the soft cell technique, so anterior plane of phaco emulsification can be done safely. No secondary instrument is used through the side port and the side port is sealed. In doing this will block the typical flow of fluid through the side port, which would have brought the billowing iris towards the side port and would have caused a iris prolapse. Now perform cortical removal with a coaxial IA handpiece using low fluidics, that is, as much of a low flow as possible without compromising the anterior chamber depth and its dynamics. In 360 manner, all the cortex is removed with the coaxial handpiece. After removal of the cortex, reform the anterior chamber depth with OVD, then increase the wound size to 2.8 mm. Now implant the IOL into the PC bag. Now dial the tailing haptic into the PC bag. Now remove the OVD from in front of the IOL and from behind the IOL. During visco removal, also maintain low fluidics. Now perform stromal hydration of the side port and main port. Care should be taken not to cause iris prolapse during stromal hydration. Now inject intracameral antibiotic and give subconjunctival dexamethasone injection. And the case is completed. Thank you, my dear friend. Hope this video was helpful in developing your surgical skills.